Experience the Galilee experience with us.
You too, they bless me.
Thank you again for finding time to be part of the show TMI this Thursday. Come Monday 21st of April, we'll be having the ITV Radio Galilee experience, and I tell you, Benin City will be at GOG, and of course Miracle Center, Church of God Mission Airport Road will definitely come alive for that program. So you look forward to it. Now today is World Oral Health Day. What is this day about? And today, interestingly, is also World Happiness Day. And very interesting, interesting. I think this World Happiness Day, to a large extent, should be celebrated by Nigerians, because, you know, they say Nigerians are the happiest people on earth. We'll be talking more on those ones in the course of the show. But for now, let's focus on the World Oral Health Day. I have with me in the studio members of the University of Benin Dental Students Association. I'd like to welcome Samuel Ajagba, is the president. Samuel, welcome to the program.
Thank you very much.
We also have Linda Iheme, is the head of media relations of the association. Welcome to the program.
Thank you very much.
And of course, Dr. Amechi Uche Anders from the University of Benin Teaching Hospital. Many thanks for joining us.
Thank you so much, sir. I'm grateful.
Okay, let's begin from the very basics. You know, I doubt if there is really no day that is being celebrated. World Head Washing Day, World Hand Washing Day, World Leg Washing Day, and all of that. And now we're talking about Oral Health Day. What is this day about? Let's begin with you.
Okay, because oral health is omnipresent in our lives when we carry out simple activities like when we smile, when we eat, when we sing, when we do some of these simple tasks. That's why World Oral Health Day was set aside, to remind us of the importance of oral health in our daily lives and how we would enjoy our lives when our oral health is good. The World Oral Health Day, it's 20th of March every year that was set aside. It used to be 12th of September, which was the birthday of the founder of the FDI, which is the international body for all dentists in the world. But it was changed because it was clashing with other days, and there was a need to choose 20th of March because, first of all, as a child, you have 20 milk teeth, that's deciduous teeth. And as an adult, at the end of your life, you should have 20 teeth in your mouth. So that's why they chose 20th of March. And if you add it together, the third month of the year and the 20th of March, that's 320. That means an adult should have 32 teeth and 0 caries or 2.
That's a realistic analysis of numbers. Yeah. That's interesting. Yeah. Okay, what are the aims and objectives of putting, of looking at this day? Yes, Dr. Iheme, I see her pointing direction to you, so probably that is for you.
What we think, usually, the statistics of oral health disease and the burden is very grim. In Africa, we might not have the real data, limited data, but we know that 90% of our lifetime, we go through a lot of health challenges, oral health challenges, from dental caries, tooth decay, periodontal issues, and any other problem. And also the risk of oral cancer has also increased tremendously. They say, the current statistics say, when you take tobacco and alcohol, the risk of having oral cancer is even higher. It's even higher 15 times. So we want to actually prevent this, all this disease, and we want to actually raise awareness and reduce dental problems, the periodontal issues, dental caries, and all those stuff. So things like tobacco, taking a lot of refined carbohydrates, refined sugars, because we know that there's a lot of adoption of taking refined carbohydrates in this part of the world. And these things actually cause dental caries. They predispose us to dental caries or tooth decay. So what we want to do is to go to the level of preventative health. So if we can say, now you are taking a lot of sugary stuff or refined carbohydrates, now what about if you brush twice a day? What about if you reduce your intake of such stuff? So what we want to do really about oral health day is the prevention aspect. So that's what we're looking at.
So, Linda, finally we're coming to you now. So what can we really do to improve oral health? And if not for the clarification that he made, I probably would have asked, is oral health about dentition, dental issues?
Okay, to the first question, what we can really do to reduce this burden of oral health diseases is the first line is on the patient or the person at home looking at us or watching us here. Like things like toothbrushing can really go a long way to reduce oral health diseases. When we say toothbrushing, you have to talk about the right time, like at least twice a day. The first thing that is first thing after breakfast, and then last thing before you go to bed. Some people will brush and then eat. You have just added all the things you just removed, so the bacteria will still have sugar to act on, which will cause tooth decay. And then you should brush with any toothpaste that have fluoride, that is fluoridated toothpaste. And for the average population, let's say an adult should brush with a medium-sized toothbrush. So toothbrushing alone have this. Then regular checkup. Most times we see people going to quacks by the roadside, and they give you all sorts of things like touch and go and many of such things. Really, they are not good. But if we could have their habit of regular checkups, that will really go a long way. Normal scaling and polishing and things like that could go a long way to reduce oral health disease burden.
Yeah, you wanted to add something to that. And now, the question I want to ask is, you said, which is the best way really? In the morning, you brush first before you eat, or like some people will do, they eat first before they brush.
Okay.
Yes.
If I should come into that.
Yes.
You know, we are creatures of habits, and most times, if some persons complain that if they brush after breakfast, that there's a tendency that they will take breakfast and even forget to brush and go to work because it's the routine in their mind. Right. But really, it's not the best because, as she said, the microorganisms, the bacteria particularly, can ferment this refined sugar in your mouth, and it could cause the tooth decay that we'll talk about. It's a whole pathology
so
that I don't
better?
want to.
Is it that
so you brush after breakfast.
You brush after breakfast?
After breakfast. Then last thing at night. I'm not saying just after dinner, the very last thing at night, because you could take your dinner brush and then you go for suya or ice cream or something. No, the very last thing at night. Okay. Then when you take, when you eat in between meals, you try and rinse your mouth or you brush. But if you take a carbonated drink like Coke or something, or any other carbonated drink, you could rinse immediately. Then you could also brush after 30 minutes, but not immediately after taking a carbonated drink.
Okay, so what are we doing today to mark the World Oral Health Day?
There's a gamut of activities. I know she wants to, she's eating, but there's a gamut of activities really, because there's a lot of awareness, because I think awareness, it all starts with awareness. Most people don't know about the mouth really, they just think the mouth is for talking, but when you come to the dental clinic, you see a lot of cases of people saying my tooth is paining me, my mouth is paining me, and they want treatment. And it's one of the real causes of why school children are absent from school, because they are saying my mouth is paining me, and they spend almost all day in the clinic. So for today, we are increasing the awareness. We're going to the marketplace. We're going to a local government market.
The secretariat?
Yeah.
Besides the Selu market.
At the Selu. So what we want to do, we want to create and to make that place a go with a lot of activities. We're giving free medical dental checks in that aspect. I don't know, Linda, you want to say something?
Yeah, free dental checkups at a local government secretariat. But this is also to mention what Benin University Dental Students Association have been doing over the years, and like for this year we've seen over 5,000 persons with our free oral health checkup. So the whole aim is prevention, because if we can prevent, then we can save a lot of money that could go into curing. But if in any case you have toothache, you have anything, seek for that, go to the dentist. Don't go to the roadside quacks that will just give you all sorts of medicine, because those persons will finally return to us. But now the situation is worse. Now they have to remove the teeth because it's totally decayed, and removal is just most likely the option because the case is really bad.
Okay, when you remove, you can't replace with a better one.
There are several options when someone loses a tooth. They call it dentures, or kind of prosthesis really. So you could have a partial denture prosthesis, a removable one that you could actually use, fix and just take off at night. You can also have a permanent prosthesis, which you call a bridge. So it depends on what you want and how how big your pocket
Okay,
is.
We also have dental implants. That's very expensive.
Yeah.
So finally, on the celebration today, you want to make a comment on that?
Okay, it's still on what she said. We're doing free dental checkup, and because health is you can't separate oral health from your general health.
Yeah.
We'll also do other checkups like your blood pressure, your diabetes, because if you check, there's a correlation between intake of refined sugar and even other ailments like diabetes mellitus. Increased consumption of sugar is one of the risk factors in development of diabetes, and is also one of the risk factors in development of tooth decay. So at times you see correlation. So we will check for blood sugar, and we check your blood pressure.
The time is 10 a.m.
Okay,
Yeah.
at
Ego local government
that's
secretariat.
Usulu Market now.
Yes,
Yes,
Okay.
yes.
All right, I want to thank you guys for coming for this enlightenment. Dr. Amechi,
Yes, sir.
yeah, thank you for coming. And Linda, thank you.
Yes.
Samuel,
Yes.
I appreciate you. Well, it's still TMI. Another break is in the offing for the news update. The rest of the program continues. Don't go away.
Academic excellence, the quest for first, a dream for greatness and leadership in all spheres of human endeavor. Then comes Igbenedion Education Center. Why is Igbenedion Education Center every child's dream? It is an international award-winning first-choice school, rated among the top 4 schools in West Africa by WAEC, operate a school-based full internet system, operate full digital language laboratories. Indeed, Igbenedion Education Center is every child's dream. Admission forms for GSS 1 and 2 and SS1 and 2 for the 2014-2015 academic session is now available on the payment of a non-refundable fee of 10,000 naira only for admission. At the admission office, Igbenedion Education Center, 218-220 Murtala Mohammed Way, Benin City, Edo State. Telephone 08078987008. At Union Bank of Nigeria PLC, Benin City, Edo State. The application may also be downloaded from the school's website at www.igbenedioneducation.com. Entrance examination and interview Saturday, 22nd March 2014 at Igbenedion Education Center, 218-220